So the first thing I would do is I would check the legs bilaterally, looking for any kind of discoloration, any edema, any swelling. I'd go ahead and check bilaterally from the inguinal ligament down to the ankles for temperature, noting any tissue changes as well. Looking for any edema of the ankles. I go ahead and check for edema by pushing in, seeing if there's any pitting left. I would go ahead and palpate the femoral artery. Okay, and I would take a pulse.
Sorry, it tickles.
And then I would palpate lymph nodes along, so going along the inguinal ligament as well, checking lymph nodes. I would then go ahead and palpate pulses bilaterally, dorsalis pedis. I do pulses checking posterior tibial. And then I would check popliteal. And then I would check the other side. Okay. Grab my stethoscope. I would then go ahead and use the valve to check for the femoral pulse. Listening for any kind of bruit. I would do a nail compression test. So I would push down on the nail, looking to see if blood returned within about 2 seconds. And I'm going to go ahead and do some special tests. So first one, we did the pitting, checking for edema, the ankles. I would go ahead and check for a hernia, locating the femoral artery, and going slightly medial. If there was a hernia, it would protrude there. Go ahead and do Bowman sign. I'm going to extend the leg up and flex the foot and then put pressure on the calf. Is there any pain with that?
Nope.
Okay, checking for thrombophlebitis. I'm then going to hold the patient's feet up for 60 degrees, waiting for all the blood to drain out of the feet. And then, okay, I'm going to have my patient go ahead and spin around and stand up without, just spin around and stand up. Okay. Checking to see that blood returns to the feet within about 10 seconds. Good there. And then I would do a tap test if I suspected any kind of valve insufficiency. So placing one finger lower and then one finger higher, and then tapping on the top valve and seeing if I can feel anything on the bottom.